Okay.
Yep.
Hello, everyone. I'm Marius Moritz, the founder of Patient Choice International, the distributors of the Goldic treatment. And today I have a pleasure of introducing to you Dr. Sharmila Tulpule. I hope I got your last name right, correct. We've been practicing. So Dr. Sharmila is a consultant orthopedic surgeon, and she's been practicing for over 25 years. With her 25 years of experience and thousands of surgeries done, she specialized in minimally invasive surgeries, and from that she developed an interest in orthobiologics. That's correct?
Yep, absolutely.
Yes. So what treatments do you offer? I know you offer PRP, you offer stem cell treatments, adipose stem cells, and what else?
So in regenerative, we've been offering very baseline platelet-rich plasma of various types. Adipose stem cell treatments, of course, BMAC, not so much now. And the latest and the most advanced, I would call right now the most advanced Goldic treatment, gold-induced autologous serum.
Yes. So this is what we would like to talk about today, because Goldic is slowly becoming recognized around the world, and including where you are, which is Dubai and Mumbai, if I'm correct. But still not that many doctors use it, even though Goldic is, from my experience, also my personal experience, is a great technology. You know, it can be used when everything else fails. Goldic seems to work. So I'd like, I'm even more happy that you are willing to share, your experience with us. So maybe I'll ask you, how did it all start? How did you first come across the treatment, and what made you want to try it?
Okay, so the start has been very, very interesting. Okay, I'll just narrate how it all started. I was heavily into orthopedic surgeries, and I was introduced to regenerative medicine by Dr. Bill Murrell, who's from the US. And I had started to do PRPs. And one day a patient who was a pilot walked in and said that, "Do you do Goldic treatments?" And I didn't know much about it, though I had heard it from Dr. Murrell. And I was just chatting up with him. And it so happened that he had been treated by Dr. Ulrich Schneider, who's the inventor of Goldic in Germany, around 7 to 8 years back for one of his knees, grade 3 degeneration. And he was asymptomatic for 8 years. He didn't have any issue, completely healed. And he had approached me for the other knee because it had started paining. And that's why I just got, superbly impressed that, okay, this treatment has lasted far longer than any of our other regenerative treatments have known to last.
So 8 years is a long time, isn't it?
Yeah. And so, of course, we went ahead with his other knee treatment, and that's how I actually started using Goldic.
Right.
And I myself, that is another interesting, episode, that I myself had developed a bad chondromalacia and osteoarthritis of one of my knees. And I got it treated with Goldic, and it was phenomenally fast and complete recovery. I had grade 3 plus chondromalacia, which was very bad. I was almost limping for many months, and within a month, I was jumping around.
Jumping and dancing.
So it was, it was reinforced by my self-experience, and that's how it all started.
That's absolutely fantastic, because I know it is so the doctors are the hardest people to actually make them try something new, with a lot of things that actually not necessarily work, getting someone to use something new is not easy. Yeah. So what do you use Goldic for? What conditions?
Oh, so I have been using it for last now more than 3 years for osteoarthritis of knees, lots of tendinopathies all around the body, including retrocalcaneal tendinitis, which is the toughest to treat according to me with conventional treatments. Very resistant tennis elbow patients. Again, I would say that they are difficult to treat. After you have failed the conventional steroid therapies and whatnot. Having said that, okay, again, shoulder tendinopathy, the rotator cuff degenerations. I've treated slap tears of shoulders. I've treated frozen shoulders. That is a common one in my practice. I've also treated carpal tunnel syndromes. I've treated lots of arthritis around the body, including the ankles, the MP joint, CMC joint. Yeah, lots of handwork I have done with Goldic. Latest have been, since last 2 years, I've been doing a lot of IV Goldic therapies
Okay.
for autoimmune and rheumatoid arthritis, and of late looks like, which is labeled as long COVID also. Though I don't have much experience in long COVID as of now, but I do intend to.
Oh, really? Okay. So, do you remember any like spectacular recoveries, for example, from rheumatoid arthritis? Because there's not much seems to work,
In fact, I mean, spectacular recoveries, lots of them, including myself, I would say.
Okay.
One very vividly I remember is a slap tear who was on the verge of getting the surgery done, and he approached me. He was around 42-year-old male, very active physically, doing gym, and he had a grade 3 slap tear, and he didn't want to go ahead with surgery, and we just did Goldic, like very precision guided, ultrasound guided injection inside his superior labrum, and within a month he was back to his absolute normal range of motion, painless. There has been another very good recovery who was an 18-year-old girl with grade 4 chondromalacia patelli bilateral, who came limping. She was a German, by the way, and she didn't even let me touch her knees. She was in that much pain, and she was just had done her PRPs and most of the regenerative treatments, and nothing has worked. And we did her Goldic, and she seriously recovered within, say, around 4 weeks after the treatment. She was climbing stairs. So that's really was good. For rheumatoid, we have lots of patients of even fibromyalgia who have no cure as such, and they literally dip into depression because of their pains, and they have also shown very good recoveries with IV Goldic therapies. One of the patients I remember for rheumatoid arthritis, she had a polyarticular rheumatoid arthritis, which had, and she had developed lots of side effects with biologics and stuff. So she was almost not able to take any of the routine rheumatoid drugs that are conventionally prescribed. And so we put her on IV Goldic, and she recovered very well. So yeah, I am trying to do more rheumatoid cases now that we've started the center in Mumbai as well. I look forward to doing more of rheumatoid work as well.
Right. Yes. So you practice in Dubai and Mumbai. Yes.
Yes, we have 2 centers.
I must say, I'm very jealous that you're not in the UK yet. Were you thinking about at all about coming and practicing in the UK at all, if you found time?
Let's see. You never know what the future holds.
That would be great. Yes. So like I said earlier, in spite of Goldic having been proven, to be so successful in so many various cases, is still not widely used. What we trying to do in the UK is to try to organize a proper level 1 trials within the NHS. So this is being now discussed and arranged, and so because what counts the most for a majority of doctors is obviously evidence, which is in a form of published papers. Could you tell us about the papers which you have published so far and which you are maybe in the pipeline?
Yeah, you're so right. Okay, I mean, unless this is all backed by a proper research, it's very difficult for people to believe. Actually, okay, even for me, it was very hard to believe that something is working so well in resistant cases. Yes, I think RCTs are the way to go ahead. Other than the RCTs, if even smaller studies which have already proven that this is a completely this is a treatment without any adverse effects, so to say. It's a very safe treatment. It's effective in cases which should be selected very well. Okay, yes. So that's thing. There are lots of research papers we have published till now about generally regenerative therapies, but the Goldic research papers, there are around 3 or 4 in pipeline, and we are also planning to do clinical trials in Dubai as well as in India on long COVID, rheumatoid, on osteoarthritis of knee, and of course spine, which is supposed to be the best indication for giving Goldic, I guess.
Yes, this is what Professor Schneider always says. Yes, he loves the spine work. Although recently I know he got extremely interested in the long COVID trial. He recently published the pilot paper. So I know as we speak, the trials in Germany and UK are also being discussed and hopefully arranged. They'll be arranged quite soon. Yeah.
Yeah. In such a debilitating aftermath of COVID, I would say that if something is there to treat these cases, that would be a boon.
Yes. So how come there's a saying that if something's good for everything is good for nothing? So how come Goldic seems to be an exception?
So let's see how this goes. Actually,
Yes.
It is basically okay. So Goldic, the serum contains very high level of gelsulin, as you know, and it's gelsulin which is effective in so many systems. Okay, right from the neurological systems to cardiac system to skeletal system, of course, and the most important immunological systems. And so now we are realizing that these long-term resistant cases are more of immunological origin rather than physical origin as such. And so we know now that long COVID is an immunological disease. Even there are lots of autoimmune disorders which will be tried again with clinical trials, which we are again planning in India as well as Dubai. And so I guess this is the future.
Yes. So yes, I obviously I read a paper about gelsulin, which is one of the cytokines which is upregulated in the Goldic process, and that paper explains a lot why Goldic could work, because, like I said, it was called names. It was called magic pixie dust, snake oil and stuff. So a lot of people are still extremely cautious, about even trying. But I know that with the growing evidence, we are not far, from having it adopted more widely. Yeah, I hope so. Anyway, yes.
You're so right.
So okay. So is there any message maybe you would like to share to your fellow doctors, colleagues?
Okay. One, I would say that don't be scared to try out new things.
Yeah.
Which have been proven to be which have been already proven to be safe. Okay, so you're not going to, do any harm in trying. And once you try, I'm extremely confident that it works. It has worked. I've done in cases in hundreds with Goldic.
Hundreds
And
already. Okay.
yeah, so I just know that this is extremely safe and effective. And that's what I've been telling you, that okay, we are soon going to publish the whole studies that we have done. So that's one. And secondly, okay, we would be starting a training center as well for Goldic, as well as regenerative therapies in Mumbai. It's already started. And so anybody who would be interested in seeing the work being done actually, on the patients being administered, or how to process it and how are the results, they are all welcome to visit my center anytime. And I would be really happy to
Okay. That's going to be a fantastic opportunity. So with your experience in the training center, yeah, everyone's welcome. So what we'll do, I'll paste the details, the contact details of yourself, your clinic, and maybe there is some link to the center, under the video, and we'll share it everywhere possible, and let's hope people will have a chance to watch it.
Yes, absolutely. Please go ahead and do it. Okay. No problem.
It's been a great pleasure, Sharmila. Thank you very much.
Thank you so much, Marius, for having me on your platform.
Yes, thank you. Thank you.
Thank you.
Bye.